It's 94.7 Blair Radio, blairradio.com. Our local guest segments brought to us by Turnkey Nerds, 402-426-NERD, and our nonprofit news brought to us by RVR Bank. So today, we're bringing back Senior Life Solutions with Memorial Community Hospital and Health System. And so you brought friends today.
I did.
So let's go ahead and introduce everybody.
All right. Well, my name's Heather Scholting. I'm the program director for Senior Life Solutions.
And I'm Amy Cirian. I'm the therapist at Senior Life Solutions.
So tell us a little bit about yourselves. Again, just kind of let people know where you're from, why you're here. So, Heather?
So I am from Elkhorn originally. Been a nurse for a little over 25 years and been working with the elderly population for most of my career, and just been with Senior Life Solutions now for a little over a year, just building the program back up and getting people the care they need for their mental health.
And just then, Amy, where do you fit into this?
Yeah, so I'm from Omaha. I've been at Senior Life Solutions for about 2 months. I have a background in mental health, but also child welfare and, ongoing case management. So I have a good mixture there. So it's my job to kind of do individual therapy in the group with our program participants to help them kind of learn new skills to cope and take care of themselves so they can kind of have a higher level of functioning and be happy.
Sure. Now, do you find just kind of, you were with child care and stuff like that, so is this kind of a change of gear, or do we all of a sudden find ourselves repeating some things we need to learn when we were kids?
I think it's a change of pace, but I think everyone at every age are dealing with the same things. There's trauma at every age, there's loss at every age, and interpersonal issues and family issues and relationship issues at every single age. It just looks a little bit different at each age. So it is different, but a lot of it is the same.
And so at this point in time, you're getting a lot of referrals to your direction?
Yes, correct. We have had a great increase in referrals, previous patients referring their friends or family that they see struggling. A lot of patients are going in for their annual exams and talking with their physicians about things that they're experiencing, whether that be their own symptoms of depression, anxiety, or losses, or even losses that they expect to be coming in the near future. And it seems like people have really opened up to the idea of accepting help being something that's more normalized in our community, which is great to see.
And so when you're looking at, like, you mentioned depression and things like that, but it comes in many forms whether you realize it or not. So kind of the scope of what you're looking at to assist, what does that kind of look like?
There's a lot of symptoms we see. We see a lot of anxiety and depression symptoms. So that could be isolation, irritability, that low mood, just not feeling great, feeling helpless, hopeless, not really looking forward to the future. Sometimes having thoughts of, not wanting to be here anymore, that, do I have a purpose? So there's a lot of that, a lot of grief, loss of, spouses, children, friends, especially in this age group. It just seems like there's a lot of loss and adjusting to, not being as independent, transitioning to nursing homes and care facilities. It's just a huge transition that you don't really understand it until you're there, I think. So we see a lot of that. So,
but there's even to those into the weeds of where, as we grew up with different generations, like, well, just suck it up and get through it type thing. So, how do you deal with that perspective? The people grown up's like, we just have to deal with it.
I mean, there's a big stigma out there against mental health, in that if you have a mental health diagnosis or you're getting therapy, that means you're weak. So we really try to push that that's not weak, that's showing strength, that, I do need help, I need support, and there's nothing wrong with that. I mean, almost everyone is going to deal with depression or anxiety at some point in their life, and it's better to deal with it, because then if you're not dealing with it and managing it, it's going to come out in ways that are not helpful, like substance abuse, alcohol use, anger. Your relationships are going to end. So, in my opinion, that's kind of how we push it. That's getting help, to be better,
Sure, sure. Well, we're going to take a quick little break, and then we're going to come back with Heather and Amy talking more about some of the programs, some of the focus this month and next month that you guys are looking at as we continue on with Senior Life Solutions on 94.7BlairRadio.com.